Well, Governor DeSantis was back at it today promoting Regeneron, a treatment proven to help patients in the early stages of COVID-19. And today he made stops in Pembroke Pines and West Palm, where he's expanding the program in more cities across Florida. But critics say the governor is focusing entirely too much on this treatment and not enough on vaccines.
And that's why an Associated Press investigation has been making some waves. Here to explain is our political editor, Craig Patrick. So what exactly did this AP story say?
Well, the AP report tied one of the governor's top donors to millions of dollars of investments in Regeneron. But let's start by putting that in context. The best way to protect against COVID-19 and prevent serious illness if you do catch it is to get vaccinated, which the government has already paid for, so it's free to get. And one of the best things you can do if you do get infected and feel symptoms is to get monoclonal antibody treatments, which the government has already paid for, so it's also free to get.
We, in fact, stop the virus from attaching to your cells, therefore they can't reproduce, and you keep the load very low.
And that keeps people from crashing and, in some cases, likely from dying.
Within 72 hours, I was 100% symptom-free.
There is now controversy over how the governor is promoting this, but it has nothing to do with the effectiveness of the treatments. Again, doctors and scientists agree vaccines and antibody treatments work. The governor's taking criticism for focusing on promoting the antibody treatments and saying comparatively little about promoting vaccines in recent months. For example, on Twitter, he's repeatedly promoted monoclonal antibody treatments and often singling out one specific maker, Regeneron, but he doesn't appear to have tweeted any promotion of vaccines since April 12th. At the same time, the governor spent Wednesday and much of the past week traveling the state to specifically promote the antibody treatments.
Monoclonal antibody, monoclonal antibodies, monoclonal antibodies.
And specifically promote the treatments produced by Regeneron.
Regeneron and others, Regeneron and others.
During these same appearances, he's also mentioned vaccines, but often in terms of their limits.
Some of them, particularly Pfizer, started to wane. Efficacy has not been quite what the clinical trials showed, not protecting against transmission to the extent that we had hoped.
And that's what's driven a lot of criticism and questions on social media as to why the governor appears to be promoting Regeneron much more than vaccines. And the governor has effectively answered that by saying he's doing it to give Regeneron more publicity.
Once more people know about it, there's going to be an even bigger demand.
That's the context of this investigation from the Associated Press. The AP revealed one of DeSantis' top donors also runs a hedge fund that invests in Regeneron. The report states the hedge fund has $15.9 million in shares of Regeneron, while the hedge fund CEO has donated $10.75 million to a political committee that supports DeSantis going back to 2018. The governor's spokeswoman then escalated controversy by responding to that report on social media with a comment, "Drag them." The AP journalist tweeted he received death threats and hate messages. The spokeswoman deleted her post, then stated nobody should be making death threats and that journalists shouldn't write stories to discourage COVID patients from getting life-saving Regeneron. And in another point of response from the governor's office, the governor's spokeswoman also stated that the hedge fund in question invests more in Pfizer and Moderna than it did in Regeneron. With that, and the CEO, of course, behind it, with that, the governor has also said he's focusing specifically on Regeneron based on research that he has seen that indicates it is more successful against the Delta variant than other monoclonal antibody treatments.
So what about to people saying that he is not doing enough to promote the vaccines? Did he respond to that?
He did, and in two different ways. He started by again defending his decision to key into promoting Regeneron. Here's how he did it today.
The state of Florida isn't paying for this. The patients aren't paying for this. This is something that the federal government bought out very early on, and it's available and it's effective. It's not mutually exclusive for doing other things.
And with that, he also said he's been doing other things. He noted 50 public events when we first started the rollout of vaccines, in which he stated that he has relentlessly promoted vaccines. But he said he's now focusing on what people need to know something more about, which in his mind is making people more aware of the treatments in addition to the effectiveness of the vaccines.
All right. Thank you so much, Craig.